This session, we will be having experts from Surgilabs Limited, Zol. They'll mainly be taking us through this session. So please, if you have any question during their presentation, feel free, type it in the Q&A, and we'll be sure to answer it at the end of the session. Housekeeping, of course, let's keep all our mics muted. If you'd like to say anything, you can always raise your hand. You can always type whatever you need on the chat box. And you can share this link with more people. I know we've just started. We are at 20 now, but we'll keep growing as we continue. So at this point, I'd like to welcome the director, the operations director at Surgilabs, Kunal, if you're in. And if you'd like to share your screen, please go ahead.
Hi, everyone. Thank you so much to the African First Aid Council as well for having us today to be able to present this this very important topic on CPR and first aid as well. I may switch off my camera just for bandwidth while I do the presentation. William, can we start the presentation or are we still waiting?
I believe in the interest of time, we can get started. We'll have the others join us as we continue. We are now at 25, so I think we have some good quorum.
Okay, perfect. Thank you so much. Just allow me to share my screen. Can everyone see my screen? Perfect. Thank you so much, everyone, for joining us this evening. As William introduced me, I'm Kunal Bhatt, the Operations Director for Surgilabs. So I'll just give you a brief introduction on Surgilabs as well. So Surgilabs is a medical supplies company, and we've been in the Kenyan market for over 45 years now. And we've sort of chosen also the brands as this time has passed, as choosing the brands which are the best at what they do. In terms of the public access safety or even the EMS, we represent Zoll, companies like Spencer, which is also quite well known. For first aid as well, we supply first aid kits from Germany called Sungen, to just name a few of our brands that we represent. So we hear about Zoll. I'm sure some of us know or have seen Zoll AEDs and defibrillators before. So Zoll was actually started by Dr. Paul Zoll in 1911. He was a professor and he was actually a pioneer in cardiac pacing. So he invented cardiac pacing. And the first for external defibrillation in 1956. So his work actually laid the foundation for a lot of subsequent clinical research in the field of cardiac pacing as well. So Zoll is a US-based company. Its headquarters is in Boston. And since April 2012, it has also been a part of Asahi Kansei Corporation as well. We have over 7,000 employees and a presence in 140 countries. So today we're going to talk a little bit about the science of CPR and defibrillation as well. We've had, we have a lot of different views sometimes of what CPR is. I'll start by a short video, and we can just have a listen.
Thank you.
So I think we can all agree that the best defibrillator is the one that is there first, although for this example seen in the video, that may not be the case. So when we talk about drowning, resuscitation, why CPR and AEDs matter? So we know that in the process of drowning, we're experiencing respiratory impairment from submersion or immersion of liquid. Drowning typically leads to cardiac arrest, and this results in progressive hypoxia or deprivation of oxygen. And both the European Resuscitation Council and the AHA, the American Heart Association, emphasize the importance of early rescue breaths together with high quality CPR when responding to a drowning patient. So, whilst most drowning casualties require immediate rescue, breathing and CPR and an AED remains a vital part in resuscitation in response. In case where we have a shockable rhythm is present, early defibrillation can more than double the odds of survival, while survival decreases by up to 10% for every minute defibrillation is delayed. I think this slide is also actually one of the really important slides because from what we've noticed as well, a lot of places that we go to, people are not as aware that even in a swimming pool environment that we do need to have AEDs. So this diagram is actually, I think this is a bit of an eye opener as well. When we look at the different causes of death as well, in perspective, we can see that heart and circulatory disorders are actually one of the largest. When we look at public access as well, um, you see in every building, I think even in Kenya and I know in across Africa, you will find hundreds of fire extinguishers. But I think it's just that also people have not really come to realize sometimes that the sudden cardiac arrest is a huge public health problem. And globally, about 1 million people each year die because of it. And most of them, unfortunately, are not in such public view. Some people suffer from sudden cardiac arrest and it's unwitnessed. But for anyone who has collapsed and it is witnessed, there's a good chance of success with the right care. So just briefly, I won't go too technical or too clinical as well. There's also a big misconception between heart attack and cardiac arrest. I know, like a lot of times, even when we ask, like, what happened, everyone just straight says, oh, he had a heart attack or she had a heart attack. But just so that we can differentiate the two, we know that a heart attack is actually a block in the artery, and this is what also then causes muscle damage in the heart. Whereas a cardiac arrest is more an electrical problem. So this is when our heart actually stops beating. The easiest way to remember this as well is a heart attack is a plumbing problem. There's a problem with your pipes in your heart. or in your arteries. And a cardiac arrest is actually an electrical problem. So as I said, excuse me, myocardial infarction, an MI, is death, infarct of heart or cardiac muscle, myo resulting from a blockage of coronary artery. So this is what is normally commonly called a heart attack. And this can be caused by a lot of different things, as genetics, diet, lack of exercise. Some of the signs and symptoms as well for a heart attack is chest pain, discomfort, radiating pain to the arm, neck, jaw, sweating, difficulty breathing, fearful, confused, irritable, in denial of symptoms as well. And sometimes after this, the patient might even become unconscious. I find the denial symptom is one of the biggest ones as well, because whenever someone is having has a heart attack or is having a problem with their heart, you always find like they'll be like, "Oh, I have really bad acidity," and these are some of the actual signs of a heart attack. So, sorry, I just lost the slide. So again, sorry. So with a cardiac arrest, the signs and symptoms again is unconsciousness, someone not breathing, abnormal breathing, gasping for air. You find no heartbeat and looks terribly sick or discolored or pale as well. The big thing with this is your heart is stopped, and this results in no oxygen to your brain as well. So what can cause a heart attack? And there's factors like electrocution, hypothermia, hypovolemia, toxins, so drugs as well can cause this heart attack. But there's actually also a big factor which is unknown. So we don't even know sometimes why some people actually get a cardiac arrest. So again, this is also big. I mean, if we actually look at the numbers, an out-of-hospital cardiac arrest in Kenya, according to the current population of 58 million, the calculated incidences of out-of-hospital cardiac arrest ranges from 17,400 to 56,300 per year. And this, I mean, again, we don't have studies as well, and also from being in the medical industry and as well the public access, sometimes we hear a lot more about these cases, and a lot of patients are transported to the hospital and are pronounced dead. So this is a big thing that we really need to be aware of. Just to give you an example of where we need to actually have AEDs. This just shows you that hotels, on boats, at dental practices, shopping centers, malls, leisure facilities, so your sports clubs, your golf clubs, your swimming pools, of course, of what we're talking today as well. We should have AEDs accessible at any time. So what do we need to do to be able to deliver both of these life-saving interventions in the best possible manner, which is high quality CPR and early defibrillation? So we'll talk a little about CPR as well. So what makes CPR high quality? There are these factors of position, depth, rate, recoil, and surface. So of course, position, we have to make sure that when we're doing CPR, that we are placing our hands at the line of the armpit. So just below the armpit is where would be your marker to where you would actually position your hands to start CPR. Depth. So this is a big one because we're all human. So we know that we don't have anything to measure. And we know that with depth, we have to push 5 to 6 centimeters or 2 to 2.4 inches, depending on where you are in the world as well. So this study just shows us an impact of depth uh, on survival. So as we can see over here, that when we're between 40.3 and 55.3 millimeters, the chance of survival and actually um, the survival after even admission is much higher when we're able to push 40 or 5 centimeters or to 6 centimeters. Rate. So we know that we have to push at 100 to 120 beats per minute. So any of us who have done first aid training as well, we know that we normally go to songs. So these are some of the examples of songs that you can also imagine in the middle of in your mind when you're doing CPR. There's also other ones like any Star Wars fans out there. The Imperial March is at 103 beats per minute. Baby Shark is at 115 beats per minute. So chest compression rates as well. There's numerous studies, and this one from Idris is also a really good one that was done in 2012. They evaluated the relationship between average chest compression rate seen across the horizontal axis and the probability of survival seen across the vertical axis, the y-axis. You can see the sweet spot there where survival is probability at its peak after adjusting for chest compression fractions at a depth and rate between 100 to 120 per minute were associated with the highest survival to hospital discharge as well. Recoil. This is also something when we compress, we have to make sure that we're also releasing as well. Because a lot of times when we are doing CPR, we tend to lean on the patient. So we have to remember that when we push down, we also allow recoil because this allows the heart to refill with blood again. And I mean, the heart exactly when we're doing CPR is exactly like a pump. So we want to try and push as much blood around the body to the vital organs and especially to the brain as well. Surface also is very, very important. We have to make sure that we have a flat surface that's hard so that when we are doing CPR, we don't end up like this cat. So the 4 main places where Zoll can help is position, depth, rate, and recoil. So just to recap again, what constitutes of high quality CPR? We have to deliver compressions on the lower half of the sternum, compress between 5 to 6 centimeters, compress the chest at a rate of 100 to 120 minutes with as few interruptions as possible, allow the chest recoil completely after each compression, do not lean on the chest, and perform chest compressions on a firm surface whenever feasible. When we talk about defibrillation, what do we think defibrillation is. Can anyone tell me? No? Okay. So first of all, I'd like to just consider these two statements. The first is the definition of what defibrillation is as per the Cambridge Dictionary. And the second is what we are aiming to achieve with a shock. So the text here is a passage from System Saving Lives, part of the ERC guidelines of 2021. The words speak for themselves. The sooner that we defibrillate, that defibrillation is performed, the better the outcomes, and this can only be achieved through public access defibrillators. Each minute of delay in defibrillation can reduce the chance of survival by 10 to 12%. Again, the same message is also conveyed over here. Arrest via early defibrillation without traditional education, CPR as well. So the big thing that we need to take away from this is that every minute that we wait after someone has a cardiac arrest reduces their chance of survival by 10%. So that means if we're just waiting for an ambulance could come in 30 minutes. 10%, that means in 8 minutes, the person only has 20% chance of survival. So what can we defibrillate? Now that we've established some facts about what defibrillation is and where it comes from, as well as why it is so important, we should look at what can and cannot be treated with defibrillation. There are two main rhythms that are shockable. These are ventricular fibrillation, also referred to as VF or VFib, and pulseless ventricular tachycardia, also known as PVT, or VTAC if you're from the States. So also, when we look at what is not a shockable rhythm, there are many rhythms which cannot be defibrillated. Any rhythm that has a pulse or normal sinus rhythm, for example, of course, we cannot shock. And also we cannot shock in pulseless electrical activity, asystole, which often, I always see this in the movies and I laugh. You'll often see it being shocked on TV programs. This is wrong, and it's not a shockable rhythm. Pad placement as well is the next thing to consider, delivering a shock. And it's the importance of electrode placement. So here we can see on this pad as well, you can see visual aids to ensure that we place the unipads in the correct manner, with the specific picture as well on the application for pediatrics as well. Yeah. And you can also see, this is also very helpful, the age and also the weight of what is then considered pediatric, which is less than 8 years or 25 kilograms and below. So why is pad placement so important? Well, the current delivered by the AED needs to pass through as much of the heart as possible when defibrillation is performed. If the pads are incorrectly placed, then the shock vector will be incorrect and not pass through the heart. There's no point in shocking the spleen. So out of hospital cardiac arrest as well, we can see the chain of survival. 9 in 10 cardiac arrest victims who receive a shock from an AED in the first minute live. Bystanders administer CPR about 40% of the time, and AEDs even less so. Your chance of survival while waiting for emergency medical services during a cardiac arrest decreases by 10% every minute without CPR. So every swimming pool, I believe, should have an AED. And we know that drowning, and this is where people think someone's drowned, why do we need an AED? We need to administer CPR, as well as probably give the patient a shock. So the AHA recommends as well public access defibrillation programs in aquatic environments. How can a ZOL AED help us as well? So ZOL has been the pioneer as well in CPR feedback. We're actually one of the only ones that have CPR feedback. So our defibrillators are designed to have real-time CPR feedback with full color display, images, CPR cycle times, and color bars showing the compression. Our AEDs are IP55 rating, and this is a key advantage in a pool environment. This is a short video just to show you a rescue scenario.
A sudden cardiac arrest can happen to anyone at any age at any time.
Anthony, are you okay?
You're right.
Anthony, are you okay? Anthony, are you okay? Can you hear me?
Look at the EED.
Call emergency services.
Responding calmly, calling emergency services, and immediately starting CPR is critical to the victim's outcome.
My coworker's unresponsive. Yeah, we're located at 523 Main Street. They say start the CPR.
Every second counts, since the chance of survival in cardiac arrest drops by 10% every minute you do not perform CPR.
The AEDs arrived.
Having an automatic external defibrillator, or AED, nearby is crucial. Since every second counts, you should ideally have an AED located within approximately 3 minutes of every location within a building.
Unit, okay. Stay calm.
In addition, a ZOL AED will guide even the untrained rescuer through proper CPR.
Check responsiveness.
It will also advise you if and when a shock is necessary.
Call for help.
They're on their way.
Open airway.
The AED-3 was designed for anyone to help save a life even without training.
Check breathing.
It is that easy to use. It guides the rescuer through every step.
He's not breathing.
Adult patient selected. If patient is a child, press child button. Remove pad package.
The latest guidelines suggest trained rescuers act as a team.
Cutter tear clothing to expose patient's bare chest.
With multiple people working simultaneously to accomplish tasks in parallel, much like a pit crew working to get a race car back onto the racetrack.
Attach pads to patient's bare chest.
ZOL's unique CPR unipads have easy-to-read diagrams directing the rescuer on proper placement on the victim. The AED-3 large display will also further guide you.
Don't touch patient analyzing.
Touching the victim at this time could interfere with the heart analysis. The ZOL AED-3 will detect the victim's heart rhythm and advise if a shock is required.
Shock advised.
Simply follow the easy instructions which are shown on the large display along with the voice prompts.
Don't touch patient. Press flashing shock button.
Shocking.
Shock delivered.
If a shock is advised, be sure you are not touching the victim and then press the flashing shock button.
Start CPR. Push to match the tone.
CPR should start immediately. The ZOL AED-3 will only provide a shock if a shockable rhythm is presented. That makes using the ZOL AED-3 extremely safe and gives extra confidence and comfort to any rescuer. Every patient requires good quality chest compressions at the correct rate and depth. This is critical to get the blood flowing and the heart back to a normal rhythm. The ZOL AED-3 will start a metronome or beep will start immediately. You should begin pushing to match the tone, compressing the victim's chest hard. Through Zoll's Real CPR Help guidance, it will instruct you every step of the way. It is the only AED solution to monitor CPR quality by providing both audio and visual cues, telling you how you are doing in real time.
Stop CPR. Don't touch patient analyzing.
This guidance provides the confidence and comfort to an untrained person.
Don't touch patient analyzing. No shock advised. Start CPR. Push to match the tone.
The depth indicator lets rescuers know when they provide high-quality CPR. The real-time feedback will provide you with information when your compressions are not deep enough. If your compressions aren't at least 2 to 2.4 inches deep, or 5 to 6 centimeters, the Zoll AED3 will let you know and instruct you to push harder. The Zoll AED3 provides the rescuer with an encouraging good compressions to let them know you are doing CPR correctly. A metronome will also guide you to achieve the required 100 to 120 compressions per minute per the guideline standard. Because high-quality CPR requires strenuous physical exertion, the guidelines recommend each rescuer to take turns performing only one cycle of CPR and resting in between.
Good compressions.
Zoll's Real CPR Help has been shown to more than double a sudden cardiac arrest victim's chances of survival.
Stop CPR. Don't touch patient analyzing. Don't touch patient analyzing. No shock advised. Start CPR. Push to match the tone.
When emergency medical professionals arrive, they will take over the rescue. To help them do so, do not turn AED off. The Zoll AED3 will provide them key information on how long since you attached the Zoll AED3 and how many shocks, if any, have been delivered.
So as we can see in a rescue scenario as well, how the Zoll AED works, I think this video actually helps us understand a bit better about the big difference between an AED that can guide you through the whole rescue. And from experience as well, what we've seen is that a lot of people are actually very scared to use an AED. But when we show them the Zoll method, it actually helps calm down the situation. And it actually is like having your trainer right there on your shoulder, telling you exactly what to do. And this is how we've designed it so that it can be used by anyone. So we do a lot of products from Zoll, but as you can see, our core business has always just been defibrillation and sort of in the EMS or emergency area of the hospitals, and also outside the hospitals as well. So we have two kinds of public access defibs, AEDs. So we have the AED3, which is on the left of your screen. And we also have the AED Plus over here on the right of screen as well. Both of these AEDs have CPR feedback, and this is shown to improve the outcomes of in-hospital and out of hospital as well. So I'm going to take you through a little bit about the AED Plus, just so that you understand the difference between the two devices and what might be right for you. So the first is the AED Plus, which has still real CPR help as per our hospital and also our public access. We provide CPR feedback on all our AEDs. With the AED Plus, you'll notice that it is a monochrome screen, and the instructions will be lit up from each light, which is on the pictures as well on the AED Plus. We also have a compression depth indicator, which you can see as well over here. And this 2 marks here, again, this is the 5 centimeter mark. This is the 6 centimeter mark. So if you are not pushing hard enough as well,
Push harder.
the AED will also tell you to push harder. And when you're doing a good job, it also gives you a pat on the back.
Good compressions.
The CPR D-pads that we provide with the AED Plus is a one-pad design. It helps ensure proper pad placement, and peel-in-place application helps prevents mishandling as well. You'll notice that we have numbers as well on the pads. The easiest is when you place your palm on the CPR landmark and pull the tabs so that you can now adhere the pads to the chest. Our pads also have a 5-year shelf life, which is an industry, it's one of the longest in the industry as well. And how we're able to even get CPR feedback is we have an accelerometer that is actually embedded into the CPR landmark over here. So this is where you will find the difference is that we actually are measuring the distance that the pad is moving. Excuse me. So when we look at our ZOL AEDs, we look at cost of ownership, which is more important. Because sometimes when we're looking at procuring AEDs, we say, we always look at which one is the cheapest one, But we find that the lowest priced AED isn't always the least expensive, especially when it comes to cost of ownership. We have simple CR123 lithium batteries, which last 5 years. Although I would suggest that you do use the Duracell batteries, which you can get from us, because they are the only ones which actually work well with our AED and also last as long. So with the AED Plus, the main things is that we have real CPR feedback. The D-pads is the industry only single piece peel and place adult electrode pad that includes CPR landmarks for proper placement during CPR compressions, and long-lasting consumables where we have 5 years for the battery and 5 years for the adult pads as well. With the 83, this is our more newer design, and it offers the rescuer a little bit more support. You'll notice the difference is that we have one screen, which is a color screen as well, and is touch screen. The same concept comes again. Compression depth indicator provides real-time feedback. The bar gauge again shows compression depth and rate in real time. And when the color changes as well, when the compressions are between 2 to 2.4 inches or 5 to 6 centimeters. So we both have audio and text prompts again, like the AED Plus.
Push harder.
And we also have a CPR cycle countdown timer. And when you're
Good
doing well,
compressions.
so we integrated a little bit of our hospital technology into the AED3, whereby we have something in our defibs where we're able to filter out CPR from the ECG. So this means that if you look at the 2 graphs over here, generally you would stop CPR and then the AED would start analyzing. what we did was the AED is able, it's something called rapid shock, and the AED starts analyzing a lot earlier. And this means that the pause time that we have between shocks and CPR is a lot less. And this is as little as 3 seconds. And of course, we know that shorter pause times means more CPR, which is actually one of the most important parts of a rescue. The really unique thing as well with the AD3, you don't have to have two different pads for adults and pediatric. The one pad can be used for both. If you do have a pediatric victim, you just press the pediatric button on the AED when it prompts you, and it'll automatically change to pediatric mode. The really good thing about ZOL defibs as well when it comes to pediatrics is we consider all pediatrics as pediatrics and not small adults. So again, we have pictures on our CPR pads which show you exactly where to place the pads as well. They can be used both on adult and pediatric. The device will also show you images to show you how to place the pads as well as on the pad package. Sorry, is my audio breaking? Can you hear me now? Can you hear me?
Yes. Yes, we
Okay.
can.
Okay. We also have integrated Wi-Fi connectivity with the AD3. This means that you can also connect your AED to our online system, which will also give you reports on your pad expiration and battery power as well. So you don't physically always even have to go. You have a record of your AED. We can also download and capture 2 hours recording of the event. So again, just to recap, we have enhanced real CPR help with a full color display screen, integrated pediatric support, Wi-Fi connectivity, and long life consumables again. Just in summary, to let you know like which AED might be the right one for you. I normally tell a lot of my clients, look, of course, budget is one thing, so the AED Plus would be slightly cheaper. But also you'd look at the pre-shock pause on an AED Plus is 13 seconds, whereas on the AED3 is 5 seconds. For the AED Plus, you do need a separate pad for pediatrics, but it does still have the specific analysis for pediatrics as well. And you can have up to 2 languages on the AD3, whereas on the AD Plus, it is single language. So when you order it, you can order it in English, French, but that will be the language that is on the AED. So we have 5 years shelf life on our adult pads for both. The pediatric pad on the AD Plus has 2 years. We have a readiness indicator on both of them, so it's easy to see if your AED is okay. The self-test as well is done weekly. And they're both IP55 rated. The AD3 has a 1 meter drop test as well. So I'll leave it to you to decide as well which AED is the right one for you. But at least we know that both AEDs will have the real-time CPR feedback. Not all AEDs, as we can see, are made equal. Just for my final point, I'd like to cite Professor Douglas Chamberlain, who said, "The only damage that you can do to someone with an AED is if you whack them on the head with it." Thank you for listening.